Adoko IET. I'm a senior specialist in oncology and radiotherapy at the Korle Bu Teaching Hospital. So as we round up the activities for breast cancer month, my center decided it was time that we spoke. And we are speaking because one of the reasons why patients don't come to hospital early is the fear of losing their breast. But there's a lot of evidence currently that shows that that's not the case. In fact, if you find your disease early and you did surgery followed by radiotherapy, your outcomes are even better than somebody who loses their breast. And so that's the reason why we had this meeting, to share the knowledge with clinicians, with survivors, and with the general public, and to sell the message that you don't have to lose your breast because you have breast cancer. You can find your disease early, and then you can go home with your breast, even though you came to the hospital with a diseased breast.
So my name is Professor Joel Yani, clinical oncologist at Korle Bu Teaching Hospital, specifically the cancer center there. We had a meeting this evening as part of Pink October. And this time we varied it a little with a concentration on picking cases early enough so that patients can be cured. We found that fear of mastectomy, fear of losing the breast is what keeps patients from coming late. So they will only come in when there's nothing else to do and the disease has become symptomatic. That is when they come in. And the outcomes are uniformly fatal when it happens that way. So we want a situation where they come early. I want to tell them this evening that when you remove the lump and you follow it with whole breast irradiation, the results are equivalent or better than mastectomy, and therefore you will not lose the breast. So that is the message for this thing. The default should be breast conservation. And another reason why patients come in late is that clinical services don't permeate to the corners, the nooks and crannies of the country. We are suggesting to policy makers, this we have written in our cancer control policy, that we want them to use the community health nurses. Every district health management team has community health nurses. So use them in their clinics as they do their immunization in child welfare clinics, as they do other clinical activities. To do tax shifting, they can be educated to be able to do breast examination. And because they are all over the country, they will be able to examine patients or examine women and pick up small lumps. It's inferior to mammography, but it is better than not doing anything at all. We want this policy to be implemented in every district health management team in the country to pick cases early.
I'm Joycelyn Okuma. I'm a breast cancer survivor and a nurse, a critical care nurse. My message is that the circles should unite with all of us to be able to remind each woman when they reach the age of 40 to remember to go for their mammograms. Mammograms are effective in detecting breast cancer early enough. So we want the telcos to rally behind Breast Society and Korle Bu so that every woman, there will be a message to every woman who is 40 years and above each year to remember to go for yearly mammograms.
My name is Yao Boatin Mesa. I'm a radiologist in Korle Bu Teaching Hospital and then University of Ghana Medical School. So our belief is that if government can help make cancer management free, then we are likely to get a lot of people who come forward to have their cancers treated. My take is that, for instance, where I come from, mammogram can catch breast cancer very early. And therefore, if we are able to make mammogram available and free, then our women will come forward, we can diagnose their cancer, and then we can treat them very early so that they will lead their normal lives. Coming from the radiologist's point of view, and in the interest of breast cancer, so to get comprehensive breast cancer care, what we are talking about is that we have to catch it early, manage it early so that our women will live normal lives. So to catch it early, we are talking about mammogram. Okay, so we have to make mammogram available and free. When we catch it early, we also want to be sure that what we are seeing on the mammogram is indeed breast cancer. So then we have to do what we call biopsy. And biopsy is also a little expensive. So if we can also get that one for free, then now we will now make it free. We know the person knows their disease. They can now go and seek treatment in the hospital, like with a surgeon or with radiotherapy, so that they can lead their normal lives.
It has been really exciting evening. You brought us together to enlighten us on the need to preserve and conserve the breast when it comes to breast cancer. I want to thank Prof. Yanni for the brilliant lecture he gave. Also, I want to thank him for his excellent leadership of radiotherapy and nuclear medicine. He has chalked so many successes, and I think he deserves a round of applause.